Ladies and gentlemen, welcome back to the Doc Talk podcast with Dr. Ray J and Dr. MJ. What's up, brother? How are you? We got a special guest today.
This is the man right
Dr.
here.
Nabeel Hamoui, our good friend and urologist.
See you, Habibi.
Welcome.
Likewise.
We are so happy to have you on. How you been? How you doing?
Good, thank you very much. I love these guys. These are the best doctors in town,
Oh,
so it's
thank
always
you,
a pleasure
man.
to work with you guys.
You're so sweet, man. Thank you so
This
much.
guy's an original.
Yeah,
He
is.
was literally, weren't you born just like,
I was born at the original, now nursing home, but the original Brooksville Hospital, which back in the day was Likes Memorial. You know, the people who
Yes.
make the hot dogs?
that's an original.
Yep.
That is
yeah.
definitely
I was
original.
born here. My dad was here about a year before I was born. And I went to, I forgot the name of the elementary school here and middle school. And I grew up here, and then we moved to Spring Hill, so still in Hernando. And then I did high school, went to undergrad, University of Miami, then med school in North Carolina, and then made my way to Chicago and trained up there, and finally came back when my brother and father convinced me to come
Right?
back.
I
You
know.
gotta, when you
Yeah.
say you trained in Chicago, you
Yeah,
gotta
yeah,
let them
you-
know where you
you
went.
gotta-
Like,
you gotta-
we're from Chicago,
Yeah,
so.
we are from Chicago, so just, you got to say
I
it. Where-
trained at Northwestern.
Yes,
Yeah,
of
and
course you did.
Northwestern,
Of
for people
course
that
you
know,
did.
that's like the Ivy League of Illinois,
Yes,
honestly.
it's top of the line. It's
I
the
was-
best.
We're
of the
proud
best.
of you, man. That's
Thank you
pretty
very much.
amazing.
I was very lucky. I had amazing teachers there. It was an amazing time. It was an amazing program. Chicago's an amazing city.
Thank you.
And you know, we considered staying there, but
You don't wanna get shot, yeah.
that and being with family down here and the opportunity to practice and really build something down here and bring my robotic skills was.
Oh, that's
all I needed,
amazing.
yeah.
And we're
For
gonna talk
sure,
about that.
for
Yeah.
sure, for sure. So that's something that we're gonna definitely talk about today. You are a urologist,
Yep.
correct?
Yep.
And first of all, we're really happy to have you on our team. To be honest with you, we're lucky to have you on our team. So thank you for that.
Patients love you too.
Yeah,
So-
and our patients love you, and we send you the majority of our patients, you and Dr. Omar Hamoui as well.
It's a
And
family
your
practice.
father.
Yeah,
It is a family.
Your
It
dad,
is-
your brother.
Yeah,
the
they're
three of-
fantastic.
Yep. There are three of us. My father's the original.
Yeah,
Original.
he is the true OG.
He
Yeah.
started in '79. I think he took over somebody's practice. I don't remember. And then there was maybe one other urologist, maybe two,
the whole time.
the whole
Yeah.
time. And I remember that, he slowly built and built and built, and then my brother joined him. But I mean, I can remember from the time I was, 7, 8 years old, man was always busy running everywhere. I go on house calls with him to like a couple of farms.
Nice.
really?
I swear,
You're
I'd be
kidding
feeding
me.
some cows while he'd be doing what he'd be doing.
Putting a Foley catheter in.
Bro,
Yeah.
his dad, I'd be at
Different
that
world.
point rounding. I swear to God, it'll be like 9, 10 o'clock at night.
Yeah.
And I'll see his dad just walking.
Yeah.
I'm like,
Chill,
what are you
so-
doing here?
Yeah, he's very
like,
chill.
I'm just
He's so
rounding.
chill.
He's
All
so
of you
relaxed.
guys.
Yeah. Well, that's
you
why I
guys
did
are.
urology, because honestly, I grew up around a bunch of doctors, and my dad, he's the one doctor that he was enjoying what he did.
Yep.
Always smiling, very chill. Everybody else would complain.
He's still working.
Yeah.
How old is he?
He's 76. He's
76?
He looks so
partially
good,
yeah.
dude.
Man, if I'm 76 and still seeing patients,
Yeah.
like
Yeah,
he's,
yeah.
that's amazing.
Yeah. He's so smart, too.
Yeah.
He's so
And-
smart.
And for
yeah.
everybody like wondering where you can find Dr. Hamoui, like we're gonna put all the information on the bottom. We'll put your number, your address, everything else, so that they can get a hold of you. in case.
He's always, every time I talk to his father, he's like, yeah, I'm covering Omar. I'm covering Nabeel. I'm like, where are they?
But that's
They're
a
at
nice
home.
thing,
Like, it's so
right?
nice
Because
to
you can
have,
communicate.
for sure.
And if
for
there's
sure.
a problem, honestly, there's some times where
Yeah.
you
Yeah, if
saw the
you're- if-
patient, and I would call Omar,
Yeah.
and he still responds. It's not
Yeah.
like it's not my patient.
No,
you
that's
know?
the nice thing. We have the same medical record system. If I ever have a question, I'm like, hey, Omar, I send him a screenshot. If
Yep.
somebody texts me, I'm like, I don't know this patient, it's yours. He'll take over and vice versa. It's really seamless and it's awesome.
I love
love
that.
it. I
You guys
love
do
it,
a good
definitely.
job.
It's
Patients
awesome.
love you guys. and-
So I'm sure that you do a lot of procedures. You see a lot of patients in the
Yeah.
in the office. What is something? And I know, like prostate issues.
Yeah.
Frequent urination, UTIs. What's something that you see on a daily basis?
Like you touch on it. I think the main thing is, well, people forget that half of our patients, or at least 30%, are women. So a lot of
Yeah.
times the women don't get, their fair share. But for men, at least, it's big prostates and erectile dysfunction issues.
Yep.
Those are the top two. And then kidney stones. And then for women, it's like you said, UTIs.
Yep.
And then leakage.
Yeah.
Leakage.
Totally
Oh my God,
underaddressed.
so
For sure. A lot of
much.
women just kind of put up with it. They'll come to see me for this, that, or the other thing. And then when I'm talking to them, I'm like, are you leaking urine? Yeah. I'm like, has that been addressed? Not really. Are you happy with it? Absolutely not.
Well,
and then we
it's
work on it.
embarrassing,
And
they
yeah,
always
for a
say.
lot of women, we can make really major impacts And so that's the one thing I think that a lot of people associate urology with men.
Yeah.
Yeah.
I agree.
Automatically.
I agree. That's something that we
big
definitely
prostates
overlook.
and
That's
erections.
what they
all
say.
Yeah, it's exactly.
It's like, wait,
Erections
you're
and
doing
prostates.
urology, so you're gonna be staring at penis all day?
Yeah.
That's
That's
Yeah,
pretty
they don't
much
take
it.
and
that
actually, I feel like there's more. Most of the time, I'm sending you females.
Yeah,
Actually,
we have a
I
lot
feel
of-
like I'm
yeah.
sending you more female than males.
Well, incontinence, right?
I know
think
it's
that's the
more
biggest
male that you
problem.
see, but like
Yeah.
it's a very common thing that we see with
Well, you
incontinence.
look at the different types of incontinence, the stress incontinence.
correct.
you
and
know,
chronic
exactly.
UTI. Oh my God,
Correct.
so
Chronic
many
UTIs.
chronic UTIs
Yeah,
that we
there
A lot
get.
of UTIs,
Like,
and a lot of people also they think it's urinary tract infections, but it's cystitis. So a lot of things that we can do that you know, I get women who come to me and say, you know, I've just accepted this and it's the way it is, and then I'm like, well, why don't we try this?
Yep.
And I would say 60-70% of the time they come back thrilled as can be.
Excellent.
And it wasn't because they weren't being taken care of properly. It's just that it's one of those really niche specialty things that only a urologist would either one care about. Or
Yeah,
have the
you
time
were,
to
I
deal
agree.
with.
I
you were
agree.
born into it.
Right,
So like
exactly.
when people talk about experience,
Yeah.
he was born into urology. Like I mean,
Correct.
literally, you were
Literally and
literally
figuratively.
born
Right.
into urology.
Yes.
So when they ask him like, why'd you pick urology? What do
Yeah.
you mean?
Well,
Like I was born into
what I've been
urology.
I had
exposed
no
to my whole
choice.
life. Exactly.
Yeah,
It was an
I had no
obligation. It was an obligation. What about, you know what? I had a patient the other day with like urinary obstruction. Do you get a lot of patients with urinary
We
obstruction?
get a
and
lot
stuff?
of patients with urinary obstruction. One of the things that I tell my younger guys that are seeing me at the very beginning of their urinary obstruction, big prostate pathways, you want to be aggressive. And the analogy I use is the following. The heart, the reason why we treat high blood pressure is because you don't want the heart to work too hard, unlike there are other muscles in your body, because eventually it'll fail.
Yep.
Agree.
Same thing with the bladder. You want to keep the pressure on the bladder low. So we do that with medication and surgery, because if you overwork the bladder, just like the heart, eventually it gives up and then you have all these problems. So we see
agree.
a lot of that, and it's oftentimes undertreated, or people wait a little bit too long to get it treated.
Yeah, that's a huge problem. And I'm assuming you see tons of BPH.
A lot of
Like,
yeah.
I mean, everybody pretty much
Everybody-
has BPH after the age of 65.
Yeah, well, you begin to see it after 40. And here's the story I have from patients all the time that are in their late 50s, 60s. You know, doc, 2 months ago I had all these problems. I'm like, well, you sure it was 2 months ago? Let's walk back. Okay, fine. 5 years ago, I was waking up once at night. Now I'm waking up 2 or 3 times at night. But that's because I'm drinking a lot of fluid. I'm like, well, were you waking up 5 times a night in college when you were drinking more?
Exactly.
No.
Exactly.
And so that's how, you know, I have to basically help them understand that this is a 25-year process.
Yeah, I agree.
And that we have to basically, we can't undo everything in 1 week, but we can certainly make a lot of progress. So we see that all the time, and it's the same
always-
story all the
They
time.
want it so quick,
Yeah.
like with erectile dysfunction.
Yeah.
My wife is gonna leave me. Fix it right now.
Fix it.
And it started a week ago, and then when we sit down and we
It
talk,
just started.
Yeah, it's just yesterday. It
Just
happened.
started.
So that's the other thing that, you know, I always try to tell patients, like, listen, we really got to walk it back,
Yeah.
figuring out everything. And then, you know, and you guys see this more than I do, but they're like, well, the pills aren't working. I'm like, well, what's your A1C?
Yeah, exactly.
9.
Yeah.
So you have poorly
It's
controlled.
not the A1C.
Right.
Yeah.
It's not, you have poorly controlled diabetes. You're on 4 blood pressure medications.
Exactly.
You know, we're not
Diuretics,
we're,
right?
You know, I
Exactly.
mean, I like to think that we can work miracles, but we're not prophets.
Yes, yeah,
and
I
so,
agree.
you know,
I
we
agree.
can only do what we can do. So,
And you got to fix those things before you can even try to
correct.
take all those
yeah.
medications.
Yeah, exactly. So we try to do some lifestyle counseling.
Yeah, and obviously screening, making sure the PSAs are done.
Yep.
And that's one thing I wanted to talk to you about. So we're not doing rectal exams, right?
Yeah, so it's a great
it's a
question.
big thing.
Yeah.
So I have patients who come in and they're like, Doc, are we going to do the, you know, finger wave? Like I'll get patients who come, they had a prior urologist, like, we're not going to do a rectal exam today. I'm like, to be honest, the PSA is completely, for the most part, supplanted the rectal exam. So PSA is a simple blood test. You can do it anywhere. If it's you know, below 3, your chance of prostate cancer is incredibly low. And then when they say, well, fine, but I want to know how big my prostate is, the finger wave, the rectal exam is as good as a coin flip.
Yeah,
So
exactly.
it's totally inaccurate.
Yeah.
So if you want to know how big it is, you get an ultrasound. So really,
There's no point.
there's really no good point in doing a rectal exam. I mean, to be bluntly honest, it really is an outmoded thing.
I had a guy actually get fully naked the other day, and he was like, "You're gonna do it," and he had everything. He's like,
yeah,
"You're
they're
doing the
ready.
rectal." I'm like,
They're ready.
There's no point. He's like, "Just do it," and I'm like, "I'm not doing your rectal exam."
So to be honest,
They're so used to it, you know.
I have that situation for most of them. I can talk them out of it, and they're relieved.
Yeah, of course.
But I get
They're
some
happy.
guys that say, no, this is an incomplete visit without.
Yeah.
I'm like,
They
you
get
have to
mad.
do it. Yeah,
Okay.
exactly.
You
Yeah.
have to do the rectal
yeah.
exam.
I'm like, you know what? Well, I'll indulge you in it, but you have to
Yeah.
know this is a waste of time. But
Don't blame me for it.
I've always had this concern about PSAs because I do see some false positives,
Yep.
right?
Especially in the gray zone,
And I've
right?
always wanted to ask you or ask Dr. Omar, your brother, because I'd have a patient, let's say, with a PSA of 7,
Yeah.
and they'll end up doing whether they'll do cystoscopy and stuff like that and get it done, get it checked, and they have prostate cancer.
Yeah.
But then I'll have a patient that has 10 and they're fine.
Yep.
I know that they're sensitive, maybe not specific enough.
Correct.
Correct. But what is your take on it? Because I'm kind of like, do I order? Because some patients that they want PSA, they want a PSA. It's an expensive lab test, but is it really necessary?
It's an area of controversy.
Yeah.
Obviously, the United States Preventative Task Force in 2008 said the recommendation is it's on a grade of A through E. F and E being bad, they gave it a D. So they said there's really no evidence to support it.
Exactly.
But after 12 years, they walked it back to a C, which basically says there is some evidence to support it. There's some evidence against it. The AUA, the urologic body, says at the end of the day, it should be the patient and the doctor should come up with that decision. So let's say I got a guy. I'll give you 2 situations. Guy that comes into my clinic had a PSA checked, normal, rising. Those guys, I'm like, listen, there's a good chance you have cancer. But if you got some guy that comes in, like you said, you don't know. So I always reassure them 30% of the time it might be cancer, but 70%, so the vast majority,
it's not.
It's not.
Yeah.
So nowadays, instead of going right to biopsy, we have other lab tests that we can do that can say, okay, PSA of 4 is not the same for everybody. So PSA for 4 for you, I run a second lab test that says you're low risk. We avoid the biopsy.
You're good.
I run a test with it for a guy who has a family history of prostate cancer. You need a biopsy. So
Do it. Don't take the risk.
We've been able to start ramping down the number of biopsies. So it's a useful test, not as useful as a urologist will tell you.
Yeah.
And not as useless as the USPTF will tell you. Like everything, the truth is somewhere in the middle.
I agree.
But it was definitely overutilized
Too much.
in the 80s and 90s. Everybody would get a prostate biopsy, and if there was one touch of cancer, it was out. And we realized that was ridiculous.
It affects their whole life.
Right, so we do a lot
Yeah.
more active surveillance. So even for people that make it through the biopsy pathway, I would say 20% of my patients are in active surveillance. So we watch it because I tell them this is so low grade. Like you said, the chance of the cancer hurting you is way less than the surgery or treatment that I'm going to do for you. So
Yeah.
don't worry
Yeah,
about
exactly.
it. Takes a lot of convincing. Like, you leave cancer in my body?
They hear the word cancer.
Yeah.
I don't want to. Sorry, I don't want to cut you guys off, but I do want to get on something while we have the time. Robotics, that's a big thing. Can you tell us why? What are some things that make patients comfortable doing it, and then versus
there really in my
not
mind.
many people do it. You're like,
Yeah,
not many.
So I think that the robot came online in 2000 at the first 2 hospitals. It didn't really gain acceptance into urology till 2006. By 2010, the majority of prostates were done robotically, and now I would say almost everybody, but 1 or 2 guys in the country, do them robotically.
Wow.
So really, anybody that's trained after 2012 and does
doing
high volume.
robotic.
So I proctor for Da Vinci. So for intuitive surgical people who make
Really?
the robot,
That's
I
awesome.
actually they've hired me as a proctor, so I go teach other surgeons how to do it. I trained with 2 or 3 amazing surgeons, and that's why I feel comfortable. There's nothing special that I do. I just was blessed with awesome
Yes. You're
lucky, of
teachers,
course.
and so
I've heard great things.
Yeah,
I mean,
so
it's perfect. You do a good job.
and it's a fantastic surgery. In my mind, there's no good reason to do really open surgery, even for tumors that 10 years ago people said that's too big. We're so advanced in what we're doing now in terms of just robotic surgery in general, not me in particular, but robotic surgery as a field, that what people would look at 10 years ago and would get nervous about, we just do as routine surgery.
Easy.
My patients for kidneys, for robotics, go home the next day. Some will go home the same day, whereas
Wow.
it used to be you keep them 2 to 5 days.
Wow.
And 95% go home with no narcotics, just Tylenol.
That's amazing.
And prescription strength
Wow.
Advil.
It's beautiful.
Yeah, so there's it's the best way to do it.
It really
I
is.
love it, man.
Honestly, man, it's been a lot of fun having you here. on
Yeah,
our
we gotta
podcast,
we gotta have
man,
you more
honestly.
often.
And I'd love to have you more often.
You guys make me feel old.
Really? Why is that?
Because look, you guys, there's not a gray hair anywhere, and
What are
I'm
you
sitting
talking
here.
about? Do you not
Look
see
at
this?
look. AJ got a
What are you
whole.
talking? It's
there-
wisdom.
Wait, you see
There's-
AJ's? You see
wi-
AJ's little hair
I
like
can
this?
count-
I know
I-
it's pointing at you, but like
I
right
can
there. it has a
count.
little,
I
like-
can count them 10. This is maybe 1,500,
You're
2,000.
right.
It's called wisdom.
Coming from the guy that's in denial. He's bald. He just doesn't want to admit it.
Yeah.
Look at him. Look at you can see.
Bro, we talk about this all the time. You know, in 3rd grade when he started balding, seriously, like he grew a beard and started balding in 3rd grade. Imagine
I'm not
being a
gonna argue
3rd
with you
grader
today.
and he had a
I'm
full
gonna
beard
respect
and
myself
bald.
in front
No,
of
you're
Bill.
good.
I'm
I
not-
promised Mom I wouldn't make fun of you,
Okay,
so I'm
yeah,
not
okay,
gonna
I'm
do
gonna
it.
talk to Mom about
We're
that, to be honest
done. We're done.
Yeah, she's gonna be so pissed at you.
My mom said don't make fun of him.
I'm
on
gonna
the
call
show,
her as soon as
so-
we're done here.
Yeah.
Mom's a mediator.
Yeah,
Yeah, she really is. She
So
really
no,
is.
it's been a blast working with you guys.
Oh,
And
same
I
here,
we
love
man.
your
love it,
patience.
And our patients.
It's a
love
great,
you.
and you always answer your phone. You always
so thank
respond,
you, man.
especially with my patients that have questions.
Yeah.
I can just pick up the phone and call you.
Yeah.
So for everybody in the community looking for a great urologist, this is the
Doctor.
man. So again, we'll put all the information if you want to get a hold
Yeah,
of
so
him.
let's just put Jason. If we could put Dr. Nabeel Hamoui's information on this episode on the bottom, so we can start. Perfect. Okay, so Nabeel, any questions, man?
No, I love this. I think this is awesome. I think that this is the way that patients can kind of learn information
Exactly.
in a very,
Absolutely.
very kind of open, free flow area. Now all we just need is Joe Rogan and Elon Musk.
That would be great.
Yeah, he's
We got
coming. He's coming
ourselves-
on next
yeah.
week.
We
He's coming on
invited
next
him,
week.
but we're still waiting.
Yeah, we're still waiting for the.
Once he
for the
takes over
response.
Twitter and he's free, he'll
Yeah,
come
yeah,
on.
he'll have
exactly,
time. Hang out with us.
exactly.
Hell yeah, man.
Thank you so much.
Thank you, brother.
Anytime. It's an
Thank
absolute
you very
pleasure,
much.
brother.
Likewise. Thank you very
Mo,
much, guys.
I'll see you later, bro.
Bye, man.
Take care, bro. God bless. Have a
Thank
great
you,
day,
guys.
bro.